Thank you very much for joining us today on the program Healthy Living. I am Adesuwa Osa Uwage. In 2018, according to research, about 13,000 women were diagnosed for cervical cancer, out of which 4,000 died. And this is a disease that is preventable if only it is discovered early. But how early can women go to the hospital? Do women even go to the hospital? What takes women to the hospital can be so different from what is later diagnosed. Some women don't see it as a priority to do a check on themselves. They don't even think it's important, in as much as there are no signs and there are no symptoms and the woman is going. Even if there are, some signs, and if the signs are not big, if they're just signs that can be looked over, of course, it will be looked over. But cervical cancer is one of the cancers that is really killing women and killing them fast. What are the signs, symptoms? How do you know? How do you test for it? How do you screen for it? These are many more we're going to be looking at on the program today. And the phone number to use is 052-290-573. So you can start calling to ask questions, okay? But let's introduce our doctor, and then we'll ask him a couple of questions, and then you will come on to ask questions wherever, however, just anything you want to know about cervical cancer. We're not asking only the women to call. A man can call on behalf of his wife because some women don't want people to hear their voice. Oh, that is also person calling. They don't like that. We're quite secretive. But this law of, secrecy does not apply to when you are ill. Okay? So let it out so that you can find help. So join me as I make welcome Dr. Steve Ogboma, consultant gynecologist. He's the CMD of Gable End Specialist Hospital here in Benin City. It's nice to have you join us again today.
Thank you very much. It's a pleasure to be here.
Okay, everywhere you hear cervical cancer, cervical cancer. What is cervical cancer?
Cervical cancer is a disease of the cervix, the neck of the womb. The womb is divided into three parts. You have the neck of the womb, the cervix, the body, and the frontal end. But in addition, other organs are attached, to the womb. So that cervix is very sensitive because the cells of the cervix have the capacity to change, to alter from a normal type of cell to an abnormal type of cells. With creation, God created it in a way that cells, when they grow, they don't grow and divide ad infinitum. When the cells touches one another, they die. That's the phenomenon of apoptosis.
Apoptosis.
Yes. Well, that's contact leading to death, death of cells. But when you now have a tumor, this phenomenon is removed, and cells just grow and multiply. In the case of the cervix, there are things that predisposes, to this abnormal cell division that takes place on the neck of the womb. So you may want to know what are the predisposing factors.
Please tell us the predisposing factors.
One, from recent research, prior to 1992, people felt that multiple sexual partners and the first age, the age of onset of sexual relationship, that was the commonest cause. The research found out that even among the nuns who were not sexually active, some of them still developed cervical cancer. So people decide to do more research, and I found out that the commonest association of cervical cancer is human papilloma virus, HPV. There are up to 100 types of HPV, but the commonest one that is associated with cervical cancer is HPV 18 and 22 and 31. So the rate with the associations of these human papilloma viral types is very high. There are other viruses, but these one, are prevalent in the causation of cervical cancer. When the abnormal, these virus, the human papilloma virus cell genome enters into the nucleus of the cells, then it makes the cells to proliferate, add infinity. And first of all, they breach what we call the basement of the epithelial lining. So long as that basement is not breached, the likelihood of spread of cervical cancer is limited. Once it is breached, then they will come in contact with lymphatics that takes the lymph away. They will come in contact with capillaries that will take the abnormal cells to other distant places. So that's where it comes when you talk about the staging. So the initial part, we just call it cervical cancer in situ. That's the stage 1.
The stage 1.
Then you have the stage 2, the stage 3. The stage 1, the endoepithelial layer is breached. Then you have the stage 2, which predisposes to other organs. It's gone beyond the cervix into the womb, the uterus. Then you now talk about stage 3. It's divided into 3A and 3B anteriorly. It can progress towards the bladder and posteriorly towards the rectum. And you have stage 4. And at these stages, the cells can go to other organs like the liver, the lungs, and things like that. So you have abnormal growth. So let me come back to the associated factor. I'll just mention the human papilloma virus, the age of first sexual intercourse, and promiscuity, having multiple sexual partners. Because you have what we call a geometric progression in terms of the relationship. You see, when a woman sleeps with a man, he sleeps with all the other women that man has had a relationship with. Because the antibodies from these women are already within this man. And they may have altered his own antibody system. That is why, as much as possible, one should restrict, one's sexual, I don't want to use promiscuity or relationship to one woman, or at the most 2 women, something like that. The more women you encounter, the more likelihood you are going to create problems for such women. And you'll find out that the human papilloma virus can infect a man, and the male partner, can give it to the female partner. And it is symptomless. This condition is
symptoms.
I know. You don't really have symptoms.
Okay.
It behaves like chlamydia. Chlamydia is dangerous, destroys the tubes, is symptomless. But in the case of gonorrhea, there is so much pain and there's so much discharge that everybody recognizes it. But one can be going about with a load of human papilloma virus without knowing the individual is carrying such infection. So, other predisposing factors in addition to what I've mentioned is infection, sexually transmittable diseases. Then the immunity of the individual. If there is any condition that reduces any person's immunity, that would predispose to alteration of cell division and predisposition to HPV. Then, apart from the immunity, other conditions that predispose to a reduction in immunity include human HIV, human immunodeficiency virus, and the AIDS disease and related diseases. So, if you have AIDS, or you have tuberculosis, or you have HIV, because your immune status is suppressed, then you are more likely, to end up with human papilloma virus. Human papilloma virus can is self-limiting. Say, for example, you'll be having a relationship, you acquire human papilloma virus. If you abstain from sex, from other conditions, that stimulates the replications of this virus. Then your body will shed the cells. Okay. Because if you bath every day, you will shed millions and millions of cells. Because this is on the surface of the skin, you can shed it off, over a period of 3 to 6 months, and you will be free. That is why in some women, part of the treatment is to ask them to use condoms. That when they use condoms, the likelihood of having this disease progressing, to ovarian cervical cancer is limited. So those are the associated factors. Anything that reduces your immunity, like HIV, tuberculosis, poor nutrition. Then conditions like human papilloma virus. Then I mentioned that predisposing factor like age of first sex and promiscuity, multiple sexual partners. Yeah.
Okay, so how do you screen for cervical cancer?
Yeah, cervical cancer, you screen for it by doing a cervical smear test. That's what they used to call the Papa Nicola smear. For short, they call it the Papa smear. What it means is that you take, the cells that have been shed from the lining of the womb, you plate it in a glass, with alcohol and allow it to dry. Then you look at it under the microscope. Then you see the abnormal cells. Okay. You see there's, with inclusions showing that in addition to the nuclei of the cell, then you have evidence of viral infestation. There are changes. The change in nuclear, what we call nuclear cytoplasmic ratio. You have the nucleus, which gives energy, where you have what the cell called the mitochondria, then you now have the plasma. When this ratio between each is altered, then you know that there is a problem.
Okay, let's look at women who are pregnant and during pregnancy to discover that they have issues with the opening of the womb, maybe like cervical cancer or something. Is it possible?
Yeah, it's possible for women who are pregnant to have cervical cancer. Okay. Yeah. Well,
so what is to be done?
It depends on the stage. If you detect it, if you detect the abnormal smear, the smears are graded. We have grade mild, moderate, and severe. Yes, if it's mild and moderate, you can temporize and just monitor the woman till she delivers. But if it's severe, then you now take into consideration the stage of the pregnancy. Because if you do so much to the neck of the womb, you induce, a miscarriage. And somebody who has been trying for a pregnancy, you don't want to do that. And at the same time, you don't want to allow the cancer to spread. That when the mother gets the baby, she loses her life. So it's a balancing act. You wait for viability, then you intervene, deliver the baby, and treatment, and you carry out a treatment on the neck of the womb. It might just be mere tracheorrhaphy, just removing the neck of the womb, or you do what we call a cone biopsy and put a stitch to prevent, the weakening of the neck of the womb and prevent a miscarriage. That's a late miscarriage, so that the woman can carry the pregnancy to term. But if it's nearer term, you just wait and deliver the woman and initiate treatment. For the woman.
How long will the treatment take?
Well, it's a surgical treatment. Once you detect the extent of the womb by staining technique, we look. You stain. Can use iodine, or you can use vinegar, the acetic acid. Acetic acid will turn it white. Iodine, the normal area will take iodine. The abnormal area we reject iodine. So based on that, you map out, when you look at it, you put it under the microscope, and you map out where you are going to remove. and the depth of what you are going to remove. Because you have been doing this thing, you know the way to move your hand to take, just 2 millimeters or 3 millimeters.
That's what you need.
Or take much more to ensure that all of the disease is taken.
Okay, let's look at the age. From what age should a woman go for screening?
Well, I will use what happens in England. In England, you'll find out that most women, the government regulations say at 25, you should go for first screening. But sometimes consultants screen when, based on the discussion you've had with the woman, and you think she might be predisposed to getting cervical cancer, then you might ask for screening. But what the best prevention nowadays, in addition to pap smear, is to give them, the antibodies. That's the vaccine now. The vaccine. Okay. To protect them.
From what age?
Initially, we say we should give it at age of 9-year-old. They say only women. But we found out that men can also have HPV. So both male and female, when they're young, about 9, 10, you give them. Okay. But nowadays, because if you include from 9 to 10, to the use of vaccine, you'll find out it's going to cost so much. So they now said we should give it much later. Yes. But those who can afford it, by the 10th or 12th birthday, they should give them vaccine. Because our girls nowadays are very, very promiscuous. Yesterday I read on the internet about a young girl who's presently at Irua Teaching Hospital, who was,
Okay, the young girl who was defied. Yeah, she was raped repeatedly
by 3 men. The number of men that had a relationship. So that young girl,
she didn't have a say. She was just too young
for cervical cancer. So she needs screening. Those looking after her, we take that into consideration, not just to manage her psychologically, surgically. They should also manage her emotionally and screen her for the disease in spite of her young age of being 12. And if she's free, then she should be given, the anti-antigen for to prevent cervical cancer.
All right, it's very difficult for somebody to just walk into the hospital, particularly women. It's not in our culture to just walk into the hospital to say, oh, I want to have a screening done, even when it is free. Because I know that there are some NGOs that, particularly towards December, early year, they come up with this free screening, treatment and all. And yet people will not, let's say women now will not take advantage. As a medical doctor, is there a way that women can be talked to, to like encourage them to go for screening?
Yes.
Out of 10 women, maybe only one would go for screening.
There is a way. We've done it before in our hospital, at Gabelen. We use handbills to tell people. Then it was on the news.
Was it free?
It was free, yeah, it was free. Screening, we screen women, that is free. I'm aware of one NGO that screens freely. But screening as an NGO is very good, but it has its own fault. You have to screen and follow up. There's no need screening, and there is no recall system. So if you screen, you should get all the details. You should screen the woman again in 3 years, because after 3 years, that screening lapses. So our women should come back for screening. In particular, the government is part and parcel of what the government should be doing to set up a screening system that is effective to invite our women, to come back. I remember P.B. Uku when she was talking about having good attitude and being a proper Nigerian, proper Bendelite, many years ago. So the campaign was so intense. So also was the expanded program on immunization. The campaign was so intense. So a lot of people bought into it. They went to churches, you know, all the gathering. At the end, somebody will mention that as your child be immunized for, you know, the commonest things like polio, measles, and yellow fever and things. So we can do it if we have the mind and the courage and the will. We can do it.
It's just that we're very religious people, particularly women, who believe that, oh, this is not my portion, and you see them, you know, things like this. Oh, it's not my portion. It's not my portion. You know, using their fingers to, like, you know, cross the head, and I don't know. You know,
but we have this
is not my portion syndrome, and so it's hard for women to, like, go to the hospital, even when there is a problem somewhere.
It's unfortunate. See, God help those who help themselves. For lack of knowledge, our people perish. We don't want our people to perish from lack of knowledge. Hence, people are making effort to talk about all these problems, to reduce the carnage of this disease. You know, as per WHO, Nigeria has the highest cases of cervical cancer in the world. And we have the highest in sub-Saharan Africa. So it's unfortunate. And you just mentioned, you know, how many?
About 13,000.
And in Nigeria,
just in 2018,
you have about 40 million people at risk of cervical cancer. So it's something we should do something about. The screening is possible, the knowledge is here, the technology is available, but we unfortunately are not doing it. One, on the side of those who provide health, more importantly, like you mentioned, on the side of the population. People don't take all these health issues very, very seriously. But until somebody dies from cervical cancer, people will not remember that there is a disease like cervical cancer. It's a disease that is preventable. You can prevent it by getting the antibodies, by vaccination. You can prevent it by having a regular pap smear, what we call cervical smear test, every 3 years.
Every 3 years,
yes,
okay.
To make sure you don't have it. Because if you have it within a 3-year period and they screen it and you just have, you know, a high risk HPV, then you are treated. You are treated, you know, even with treatment with just use of condom over a 6-month period. The likelihood of having disease or the disease progression is reduced. And if it has deteriorated to involve the tissue and the basement membrane has been breached, then you get a small treatment and it's curable. But when you start having stage 2B, stage 3, 3A, 3B, then stage 4, then things become very, very serious.
Unfortunately, some women are quite innocent until they may bring the antibodies to the women.
Which is very, very unfortunate. And it's very unfortunate. But when a woman is pious, so to speak, and she keeps to her vows, and the husband is very promiscuous, it's an unfortunate situation. You know. But we know that both men and women, they carry the virus for HPV. Yes.
All right, the program is Healthy Living on ITV, and our phones are open, so give us a call. Call doctor, ask him questions about cervical cancer. And I'm sure you have quite a number of questions to ask, and the men too can ask questions because unadi waka, you know. Doctor said it, not me. I only just butchers it in pidgin English, all right? So doctor did say that waka waka is not good when it comes to this disease, okay? Some men can carry it, and then before you know what is happening, the woman becomes a victim. Multiple sex partners is quite evil. So if you want to keep yourself safe, you also have to do away with multiple sex partners, and ladies too, because there are so many ladies now who think this is enjoyment or something, but it is not. You might just come down with a disease. So the number is 052-290-573. It's right there on your screen, okay? So give the doctor a call and let us see what's going to happen. The calls are beginning to come in. It's 052-290-573. ask the doctor questions you may want to know. So, doctor, while we're waiting for the calls, can you just tell us again, in simple language, ways to prevent cervical cancer? In very simple language. Okay. You've told us, don't do this, don't do that, don't do that. Let's just, you know, for emphasis sake.
Okay. Well, sex education, advise your children, both male and female, to avoid early sexual exposure, because the cells of the neck of the womb, they are not very, very mature. They can easily undergo change. That's the age of first sexual exposure. Number 2.
So what's the best age for somebody to get exposed to sex?
Well, if you ask me, I would tell
I should ask you because
yeah, until you're married, you should abstain if it's possible. But if you must, at least you should be above 18 in this country, the law, and be an adult. But if you must, then you should use a condom.
Protected sex, sort of. Okay. All right, caller. Hello. Hello, good afternoon. Okay, while we're waiting for calls, what about treatment? Let's look at treatment for early stage, and then let's say where surgery comes in.
Before you have the stage, you call cervical cancer, you call it pre-cancerous stage. If you detect abnormality, you know, I talked about the use of condom, then you can have what we call a loop excision. It's a slice of the neck of the womb. I sent to the lab, confirm diagnosis. And when you slice that neck of the womb off, you know, you slice it off with the disease. And the patient
would the patient be able to get pregnant?
Yes. You know, it does not affect pregnancy.
Okay.
Okay. So there are other things. If it's larger and it's breached the, you know, the basement membrane, you can do what we call, you know, a cone biopsy. Cone biopsy takes a bigger chunk, you know, and you send that to the lab to confirm what the problem was, and usually you take everything with it.
Wow.
And it cures the patient.
Okay.
And sometimes you can have other diseases in the endometrial lining, which that cone biopsy can also treat.
Okay, let's quickly take this call now. Hello, caller, good afternoon. Hello?
Hello?
Yeah, good afternoon.
Good afternoon, doctor.
Please tell us your name and ask your question.
My name is Chooks.
All right, Chooks.
Hello?
Go ahead, Chooks.
All right. I'm a regular listener to this program. I came in late. Please, I just want to ask Dr. a question. One, the causes, actually, I didn't get the possible causes of cervical cancer.
Causes? Okay.
Possible, the symptoms. Then I want to know if it is transferable.
Okay. All right, Chooks, you obviously came in late. All right, he wants to know what causes cervical cancer, the symptoms, and then to know if it's curable.
Okay. Yes, let me start from the list of them. Is it curable? It depends on the stage you pick it up.
Okay.
If you pick it up quite early, yes, you can cure it.
So early presentation, it can be cured.
But the best thing is to prevent it happening at all. Either you have a vaccination to prevent it, or you do regular cervical smear screening. And if they detect it quietly, they can treat it for you. Okay. Then what are the symptoms? Generally, cervical cancer at the very onset is symptomless. You can say it has no symptom.
Okay.
But later on, when it progresses, you know, to stage 1A or 1B or 2A, then some women can bleed. Some women can have longer periods. Some women can bleed in between their periods.
Okay. In
pregnancy, they can bleed as well. Oh, they can have pelvic pain, but usually it is mild discomfort. Then in the later part, it can affect the bladder, and it can make you go to pass urine very often. We call urinary frequency. And towards the back, at the later stage, it can do damage to the rectum, and that can cause diarrhea disease. So all these are the symptoms. of cervical cancer. But you see, these are symptoms that can be caused by so many diseases. So the thing is, you need to see someone who is competent, who specializes in the area, so that in addition to checking other things that can cause it, you will remember that cervical cancer is one of them to check for it.
Okay. Hello, caller. Good afternoon. Yeah, please tell us your name and then ask your question.
Yeah, my name is Esosa.
All right, Esosa.
Yeah, I want to ask the doctor a question.
Please go ahead.
Okay. I have the baby that is breastfeeding. So, and a mother used to complain about...
Esosa, can you hear me? Esosa.
Hello?
Yes, please come again with the question.
Yeah, I said I have the baby that is still breastfeeding, so that the mother used to speak about waist pain and leg pain. So I don't know what to do.
I'm finding it so difficult to hear you.
Okay, pain in our waist and in our knee.
Oh. Honestly?
Hello?
Can you just ask that question again?
Okay. I have a baby boy, so that is 7 months.
Okay, you have a baby boy.
Yeah.
Okay.
So, and then the mother used to complain about waist pain.
Okay.
So, and then knee pain.
The mother is complaining about waist pain.
Yeah.
Okay. I'm listening to you. You want to know if that is a sign of cervical cancer?
Huh?
You want to know if that is a sign of cervical cancer or what?
I can hear you.
You said you have a baby boy and the mother is complaining of waist pain.
Yeah.
Okay. So, what do you want to know?
So, I want to know what's the cause of that pain. That pain.
Okay, the cause of the pain.
Well, there are many causes of waist pain. It might just be musculoskeletal, which is the commonest thing. It might just be strenuous work. It can be water infection, what we call urinary tract infection, because the tube that carries the water from the kidney passes through the waist.
Okay.
It can be pelvic infection, what we call pelvic sepsis. So it could be a number of things. Even problems with the back passage can cause discomfort in the waist. So it's unlikely to be cervical cancer because when she went to deliver, medical staff would have looked at the neck of the womb. If there was something that is very obvious, they would have been able to refer her, to a gynecologist who would have taken care of her. So just give her something to relax the muscle, then another thing, something to take away the pain. And if after a week is persisting, my advice would be to go and see a doctor.
Okay. Thank you, sir.
Okay, thank you.
All right, the number is 0522905573. Hello, caller. Hello. All right, when you're calling, try as much as you can to reduce your audio level on your television set so that we'll be able to hear you properly. Okay, while we're waiting for more calls, hello? Hello? All right, doctor, a text message came in to say that what could be the reason why a woman will be experiencing consistent back pain, waist pain. Sometimes the pains will move to the side after a hysterectomy section or surgery.
Well, you see, when you have surgery, in certain situations, the healing is just perfect and everything goes well. But sometimes things don't go well completely. You end up with what we call adhesions or cicatrization. When there's adhesions, it pulls so many organs within the pelvis together. And depending on the posture you assume more often, you find that when you stretch, you have discomfort and you have pain in the waist. But on the other hand, it might just be your sitting position. You are sitting in your chair you know, you use computer and you are adopting the wrong sitting position. You have pain in the lower segment of the spinal column. But most from post-surgery is more likely to be from adhesions. You mentioned cesarean section and a hysterectomy. Yes, you can have pelvic adhesions from these two major operations, and that can cause a discomfort. So if there is facility for laparoscopy, so there are two types, mini laparoscopy. You put a needle that's got a small camera in it, then you look at the pelvis. You put it in a through a delicate position, you know, to have a look at all of the abdomen and the pelvis. So in that case, you'll be able to detect exactly what is happening, because more surgery will create more adhesions. So you try to avoid more surgery. But sometimes you find that when there are adhesions and you do a laparoscopy, you expose the person to risk, because risk of injury during entry into the abdomen. But it can still be done. Okay.
All right, the other question is this. She doesn't want him to be called, that she's billed to have a section, a hysterectomy section, because she usually bleeds during intercourse, and then she went to the hospital. She did several tests. She didn't mention the test she did. She did several tests, several investigations, and it was discovered that she had to remove everything.
At cesarean, during the delivery of the baby?
No. She usually has usually have bleeding during sex. Okay. And then she had gone through a lot of investigation, screening and all, and it was discovered that if she does not do a total hysterectomy, the cancer will just spread. And
so she's got cancer?
Yeah.
Okay.
Early stage.
Yeah,
but
to detect that, they would have taken a small biopsy and looked at it under the microscope to confirm.
Her scare is that she has not had a child. She's not even married. So why would she doesn't know why she should do that?
Well, it will be difficult to advise you because it depends on the stage of the cancer. As I told you, if it's just carcinoma in situ, where it's located to one spot, it can be removed. You don't require to remove all of the womb and maybe the ovaries. But even if it's just stage 1A, you know, you can try to conserve the uterus so that the woman can go on and have a child. But beyond that, you know, 1B, you will need to do more to remove the uterus. So I cannot advise you because I do not know the stage of the disease. And it depends. Those who are looking after you, they know the stage of the disease. So if they've advised a hysterectomy, yeah, you should go ahead. Having a child is not the end of the world. You can adopt. There are so many children that require good homes, that require motherly care. So you can adopt from any of the charitable organizations through your church. And it's not very difficult to adopt a child, because you are coming up and saying you will look after this particular child. And that child will be yours, because you will register the child with the government of the Federal Republic of Nigeria, because all the laws of Nigeria are applicable in Edo State. So you can adopt a child you didn't have, and call your own child. But the best adoption is to do it very early, once the baby is born, and for a young child who does not require, who lack the capacity to look after a child, either financially or psychologically or in terms of economically, then that child can give, that individual can give away the child and you can adopt. So adoptions are possible in Nigeria, and it doesn't mean you'll be childless. You can still have a child you call your own, legally, by legal adoption. All
right, Francis wants to know why, he came in late into the program. I want to know what you meant by saying that men are carriers.
Men can have human papilloma virus infection. And I mentioned the types that are prevalent in the causation of cervical cancer. A male can carry HPV from one woman A to woman B.
Okay.
So that's what I meant by saying men are carriers. They have picked it up from another woman.
Okay.
But because they have picked it up, they can also carry it to another woman. Yes. You know, most of the viral diseases, you know, can be picked from one woman to the other, including human HIV.
HIV.
Yeah, it's a viral disease. And viral disease is not something you can cure with antibiotics. That's why they are very deadly. HIV you cannot cure. HPV you cannot really cure. You know, but you can whereas HPV is self-limiting, HIV is not self-limiting. So those are the two differences. But they are both viral infections, which you cannot cure with antiviral agent. You can control them.
Okay, hello caller, good afternoon. Good afternoon. Michael. Okay.
The doctor mentioned the minimum age a girl can take the vaccine for prevention. What is the maximum age for somebody, maybe a girl who is not yet sexually active?
I didn't get that.
What is the
minimum age to take the vaccine for prevention? That is what age for a girl who is not yet sexually active?
I'm finding this so hard to hear you.
All right.
So
let me
repeat myself. Can you move away from your television set?
All right, let me move away. What is the maximum age at which a girl can take the vaccine for prevention of cervical cancer? Because the doctor mentioned maybe 10, 12.
Okay, let me turn on my volume. Okay, go ahead with your question. Ask your question again.
Right. What is the maximum age, that is the oldest age a girl can take the vaccine for prevention?
All right.
Okay.
Yeah, I got that. The minimum age, yes. Minimum age is 8 years. You know, they can have the vaccine from 8. And they can have the vaccine.
From 8?
Yes.
So is it one, just once, or?
No, the vaccine, you take it on 3 occasions.
Okay.
1 month apart for it to be effective.
Okay.
Yes.
So 3, after 3, you're good.
The person will be protected.
Okay. So 1 month apart from 8 years.
Yes.
All right. So 0522905573 is the number. Give the doctor a call and let's see. So, doctor, while we're waiting for calls, at what point does a woman go for surgery to do total removal of her womb, ovaries, and everything together?
Well,
maybe a hysterectomy, total hysterectomy.
Well, to have a total hysterectomy, there must be a reason. You know, in this part of the world, nobody wants to lose an organ because our people believe in reincarnation. And so when they come back, they may not have these organs again.
Okay.
All right. But if you have to remove the womb or the ovaries, then you have to. If there's a predisposing condition, for example, you have a cancer that has spread, you know, stage 2B, stage 3 and above, you have to remove the womb. You know, if you have a cancer of the ovary that can kill somebody, you have to remove everything. That's it. The most common cause of removal of the womb and ovary is malignancy. So when you have malignant tumor anywhere in the pelvis, you do pelvic clearance. In certain situations, if it involves the bladder, we do what we call anterior exenteration. Anterior exenteration means removing the womb, the ovaries, the tubes, and removing the bladder. Then at that time, you reimplant the ureter into a pouch created by a part of the intestine.
Okay.
So also, if there is a cancer that has spared the bladder and it involves the back passage, that's the gut, the rectum, then you can remove all of the rectum and maybe the inner region, and you now create a colostomy. The feces come into a bag and it's changed in a hygienic manner every day. And you get your colostomy bag, and you might get a colostomy nurse that will assist you. And you can still live a normal life. So all these things are possible. But people talk about quality of life.
Can you reduce the audio level on your television set, please, when you want to call us? Okay, doctor.
Okay, so you talk about quality of life. You now ask yourself, a man that cannot go to pass urine, or a woman who is not able to go to the toilet, can pass feces, it cannot pass urine, then and the person is having to have a colostomy, she will now ask herself, what's the quality of her life? You know, they need some psychological support from the medical staff, from nursing, from psychologists, so that they are able to cope. You know, it might not be the disease that will kill such an individual, rather the depressive illness associated with the condition, that will make her lapse. That's the problem.
Okay. Hello, caller. Good afternoon. Hello. Do us a favor. Reduce the audio level.
Yeah. Good afternoon, madam.
Good afternoon.
My name is Godwin from Benin City.
All right, Edwin. How are you?
My name is Godwin from Benin City.
Godwin. I can hear you. Good afternoon.
This cervical cancer, how much is the cost to do the test?
How much is the cost to do the test?
The test, and whether is it covered by NHIS?
Okay, Godwin, we cannot tell you the price because for cervical pap smear test. When you go to the hospital or to the screening center, I'm sure you'll be able to find out the price when you go there. 052-290-573 is the number. You have that number on your screen. Call the doctor, ask a question. Hello, caller. Good afternoon. Hello? Hello? All right, call us. Let's see how we can help you. We don't call drugs on the program. We don't do drugs, okay? And we don't know prices because we don't work there. But is it expensive?
No, it's not expensive.
It's something everybody can afford.
Like I said, some NGO, they do it for free.
Okay.
And we have done it for free in our clinic.
When next are you going to do it for free?
In February, we will be doing it for free in Benin. And we may go to, is it all one or, in not one area, I don't know. Okay. We hope to visit one of the villages there and do it for free.
For free.
We will let you know. Yeah.
All right. Hello, caller. Good afternoon. The number is on your screen. Give the doctor a call. I know that a lot of us don't want people to hear our voices, but you see, if you call and ask the question as it is. Hello? 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 If you reduce the audio level on your television set, we will be able to talk. Hello? Hello, caller.
Hello?
Hello, good afternoon.
Hello, good afternoon.
Good afternoon. Tell us your name.
Yes.
Sorry?
Esther.
Esther. Okay. Where is Esther calling from?
Like seeds in my left leg, so I don't really know what it is.
You have something like seed?
Yes, my left side breast.
In your left breast?
Yes.
And you don't know what to do?
I don't know what it is.
You don't know what it is?
Yes.
Esther, you will go to hospital. Oh. You just have to. You don't have something like seed in your breast, whether left or right, and you don't know what that thing is. Don't wait to know what it is. I'm not a doctor, but I know that I can authoritatively tell you to please go to hospital, a competent hospital, okay? That's where you should run to. All right, time is not a friend. Woman, if you find anything apart from Esther now, you know, you find any lump in your breast, no matter how small, no matter how tiny, your best bet is to go to the hospital. All right, we've been talking to Dr. Stephen Ogboma, Medical Director, Gable End Specialist Hospital here in Benin. He's a consultant gynecologist, and we've been talking about cervical cancer. And I'm sure that you've been able to pick quite a number of things. You've gotten some medication. You know where to run to as soon as you notice anything. Once you're 28 and above, yeah, doctor? Is that what you said?
18.
Okay, once you're 18 and above, you should go for screening. Just go to the hospital. You don't have to wait until you are sick.
25.
25 for screening?
Yeah, you should do it every 3 years.
Okay, once you're 25 and above,
Yes.
you don't have to wait until you're sick or you find anything.
Yeah, once you are 8, both boys and girls can have
Vaccination,
vaccinations.
okay? And above all, promiscuity is something you should not be involved with. All right, do a follow-up by calling this number, 070-5507-1439, 070-550-71439. And that's all we're going to do today on the program, Healthy Living. Join us on Thursday on radio, where we shall be doing the Pidgin English version. Dr. Steve, thank you very much for being on the show.
Yeah.
We'll see you again next week, Monday. Until then, play safe and live very, very healthy. Get a healthy lifestyle and you'll be happy. I'll see you.